PHR's asylum network, which represents 1,000 clinicians around the country, has conducted literally thousands of forensic evaluations of parents, children, and families who are arriving at our borders. And the medical evidence emerging from these forensic evaluations is very clear that family unity and keeping parents and children together is vital for the resilience of children. And separating parents and children is absolutely devastating. It's very harmful, both for the short term and in terms of its long-term effects, even on the neurodevelopment of children, and can result in impairment of their social, emotional, and cognitive functioning. Through this letter, Physicians for Human Rights and thousands of medical and mental health professionals call on the administration to immediately end the practice of separating parents and children at the U.S. border. In previous administrations, it was an accepted practice that families who were applying for asylum, parents and children who arrived at the border together, would remain together while their proceedings were pending. These families can be placed in community-based settings. There are many different options, humane and rights-respecting options, which take due consideration for child welfare. And instead, the administration has chosen to have a harsh and brutal reversal where asylum seekers are being prosecuted criminally for border entry, and where children are being stripped from their parents. And at PHR, we find this to be so shocking that such little consideration has been given for not only the human rights of these families and the human rights of parents to have custody of their children, but also the medical implications, the medical and mental health implications of this harmful practice. One research study among refugees showed that individuals who were separated from their families actually had mental health outcomes that were affected in terms of depression, PTSD, and psychological well-being. And the contribution, when 26 forms of trauma were assessed for their contribution across these mental health measures, only family separation and torture were the two types of trauma which were so strongly correlated across all measures of psychological well-being.